I am so excited to have you guys all here tonight. Thank you for taking some time to spend with me this evening to hear about our strategic plan. I am okay, sorry. Chat is disabled, which is not good. Catherine, if you can just try to figure out the chat issue as I move forward, the chat should not be disabled. I can see chat, but it doesn't look like the participants can have access to the chat, which we want to make sure that they have access to. Hold tight, everybody. Okay. Okay. Can someone confirm that chat is able yet? Still disabled.
The Q&A works, so we should be okay.
Okay. So if you guys, perfect, that's great. If you have, and we'll get to that in a minute, but we will utilize the Q&A for any of the questions and answers, which I'll get to here in a minute as we move forward. But I just want to thank everybody for being on tonight. It looks like we have a really great crew, and I'm so thankful because I always know that trying to get on at this time of night can also be a challenge for everyone. So thank you. But we felt like it was really important that we come on and share with you all the strategic plan for the Angelman Syndrome Foundation moving forward. And just for a little recap before I share my screen and show you all the fun stuff. Usually our last strategic plan lasted 3 years. Usually strategic plans can be anywhere from 3 to 5 years. And so tonight our plan is to just kind of show you what our next strategic plan is starting from 2024 for the next 3 years. The great thing about strategic plans is that they're fluid. They can change based on the needs of the community. And so what I show you tonight is what we're striving for, but also knowing that at any point, if we need to pivot to meet the needs of the community, we will do that as a foundation. And so I want to make sure to emphasize that at the beginning before we get started. I will go ahead and share my screen, but also to let you know, we have some of my amazing staff members are on to moderate and answer questions. If you want to answer or ask any questions or have any comments, use the Q&A function to be able to do that. And we will make sure to answer as many questions as we can. And it looks like Catherine said chat's open as well, so feel free to chat as well. We will do our best to monitor everything. If we don't get to everything tonight, rest assured, I hope for those of you that know me and know my staff, we will make sure to answer it, and we'll make sure to get as many get this feedback to you as much as possible. We are an organization that serves you and is here to support you, so we want to make sure to get those questions answered. So I'm going to go ahead and share my screen. It looks like we do have the chat open, so that's fantastic. Feel free to use chat or Q&A. I have amazing Chloe and Catherine are on tonight. Catherine, who is our family service director, and Chloe, who's our community engagement director, are on tonight to be able to answer any questions that come up in the chat, or if there's any feedback you want to share as well. So let me go ahead and see if I can share my screen okay here. And then I'm going to ask Chloe or Catherine if you could just tell me that all you can see is the transition of the screen. If you wouldn't mind just giving me a thumbs up in the chat that that's what you see. Is the screen. Okay. So perfect. So we're going to move forward. And like I said, tonight is the night to just kind of unveil our strategic plan. I'm going to go through each parts of the strategic plan, but please know that I'm not going to be able to go through everything we're going to try to do to meet each one of those goals. My goal of tonight is to kind of give you an overview of what this looks like, but also knowing like we have some ideas for this year, 2024, to help try to start meeting those goals. but also knowing all the excitement that's going on in the Angelman community and what's going on with advocacy, with research, with clinics, everything. The Angelman community is in a constant movement, right? It's kind of, we have to be flexible and being able to change some of those things. As you can see, I'm not in my typical space. I'm actually literally just came from the White House. Myself and Ryan Fisher, who is the Chief Operating Officer from FAST, had the honor and privilege to be invited to the White House tonight to have a White House Forum on Rare Diseases. And so there are amazing things happening with advocacy. Angelman was at the White House tonight. I brought you all with me, and so did Ryan. And so thank you for being flexible and enjoying the great hotel room that I'm in tonight. Okay, let's get started. So first of all, I want to make sure people understand how we came to this strategic plan, because we very much value your feedback. I want to thank everyone who provided any sort of feedback to get this plan. We did a community survey, which we had some great responses to. We also did a stakeholder survey, which a stakeholder survey typically involved our industry partners, our researchers, our clinicians, any of our collaborators, any of our partners, to get an idea and get some feedback from them on the strategic plan. We did some focus groups, and we also included and involved our parent advisory committee. So my hope is that we were able to hear voices from everyone in our community in some sort of way. But keep in mind also, if you get to the end of this evening and think, you know what, I think they're missing the mark on something, or I don't feel like my desires were represented, or whatever it may be, please don't hesitate to reach out. Like I said, we work for you. Our goal is to serve the community. You are our #1 stakeholder. So we want to make sure that we're getting it right. So feel free to reach out. Once again, we value feedback. Please share your questions or feedback in the chat or the Q&A. We're going to strive to address all that I possibly can tonight, and with Chloe and Catherine. And in the event that we're not able to address everything tonight, rest assured we will acknowledge and respond to every question that comes our way. My goal is to keep this within an hour, because I know you guys are very, very busy and have a lot going on. So we will do our best to address everything we can. So the big reveal. So what I'm first going to show you is kind of, we've created basically a one-pager of what our strategic plan is. So I'm going to show that to you briefly, but then I'm going to move quickly on, because I'm going to go through each single step. So this is our 2024-2027 strategic plan. This will be available on our website. You can pull this off at any time and have it and look at it. But this is kind of the easy layout of it. And I'm going to go ahead and switch to the first page, and we're going to go through every single one of these for you. So I think it's always important to level set, to remind everyone what the mission of the organization is. And this mission was created 31 years ago by 4 families sitting in a hotel room saying, you know what? There's no treatments, there are no, there's no symptomatic treatments, there's no clinics, there's no support, there's nothing for those living with Angelman syndrome. So we need to do something about it. And these 4 families came together and created the Angelman syndrome. And their mission statement is the same as it was then as it is today. And the mission of the Angelman Syndrome Foundation is to advance awareness and treatment of Angelman syndrome through education and information, research, and support for individuals with Angelman syndrome, their families, and other concerned parties. We exist to give them a reason to smile, with the ultimate goal of finding a cure. It's a big mission statement, and it was, it's beautiful to know that these families were thinking of this even 30 years ago, and I think it still very much applies today. But we really try to live and breathe by our mission statement. So this is new. For the next 3 years, we really want to focus on this statement. This is our impact. This is the impact we want to make on our community. And that is that the Angelman Syndrome Foundation will provide essential access to resources, a connection for emotional and physical well-being, fuel for innovation, research, and a world-class clinical care, while advocating for all. was resulting in a full and meaningful lives for everyone touched by Angelman syndrome. So our goal is really to support not only those living with Angelman syndrome, but those that are around them, our caregivers, our siblings, our grandparents, anyone who is touched by this. We really, really want that to be the impact moving forward. And Catherine and Chloe, just so you know, I'm not able to see anything because of the screen going on. So if there's anything I really, really need to know, please let me know. So another thing that I want to address is that one thing that we have noticed in the last few years is that we really need to be committed to access and understanding where there's a gap in people knowing what services are out there, knowing, you know, that Angelman syndrome is not, does not choose a specific ethnicity, a specific socioeconomic status, that Angelman syndrome is affected by all. So we really want to value and understand diversity, equity, inclusion, and recognizing the diverse backgrounds and circumstances of all those are affected by Angelman syndrome. You know, we're dedicated to creating a culture of respect, equal opportunity, and support for everyone to participate fully in the mission. We believe that diversity enriches our organization, and we're committed to continuously educating ourselves and others and seeking out diverse perspectives and taking meaningful action to create a more equitable world. We want to make sure that we're hearing from all of our families, no matter where you are at in the, you know, in the journey, no matter whether what genotype you are, no matter what it is, we want to make sure that the ASF is able to be accessed by all. We want to make sure that our clinics are being able to be accessed by all. We want clinical trial opportunities to be open to all. So we're really going to continue to commit ourselves to being able to do that as we move forward as an organization. So I want to move forward to our first category. As you could see, as you remember, our impact here, and I'm going to go back for a minute. As you can see here within these 4 objectives and initiatives, these are the ones that I'm going to go through. So the first one, and you move forward here. Make sure everyone can still see. Okay. Our first one is, sorry, I'm getting triggered here, is providing access to holistic resources. So our goal is to achieve a 20% increase in engagement with families. Now, what you're going to see are things that we're going to be working on in the next, 6 to 12 months, but this doesn't mean this is the only thing we're going to do in the next 3 years. Way back in the day, we had a program, and we still have a program called the Family Champions Program. The one thing that we recognize is that the most important phone call sometimes you can get as a newly diagnosed parent is another parent, especially another parent that lives maybe in your state or even in your city, and being able to have those conversations. My first phone call was with a parent who had a child, an individual with Angelman syndrome, who was 8 at the time, and Jackson was 2. And I can't tell you what that phone call did for my outlook and understanding what our future would be for Angelman syndrome. And so we are going to reinvigorate the Family Champion Program. It's going to look a lot different, and we're also going to be recruiting for more champions. We want to make sure also that we have champions from all walks of the journey, that we have newly diagnosed champions, that we have those that are entering maybe puberty, those that have adults with individuals with Angelman syndrome, so that there's a champion that can always be able to connect with families to help them through whatever that may be. So stay tuned. We're going to be releasing that very soon, probably within the next month, the kind of reinvigorate the Family Champions Program. And if you're interested in being a champion, we would really, really love to hear from you, and we'd love to connect you in that way. We're also going to look for meaningful engagement with our newly diagnosed families. How can we make sure that our newly diagnosed families feel very connected and that they have resources, that there is hope, and that they're not alone in this journey? Even if it's simple as, being able to understand the insurance navigation. Sometimes that's the hardest thing. It's just being able to get access to therapies covered by insurance. And so we want to make sure that our newly diagnosed families understand the resources that are out there for them. And so we will be working around that for sure. We are also going to be partnering and working with another organization to refresh our ASF resource library for improved accessibility for critical information. For those of you who have visited our website, it is 30 years of knowledge of families who have really, or for the organization who is, for 30 years found resources, connections, partnerships. We're excited that we are going to be revamping our website to make it a little bit more accessible and easy to navigate. But this ASF resource library will really give you the opportunity to access resources within your state, within your city, and it's going to be a really great resource for families as we move forward. The other thing we're going to do, and the thing that we've been really proud about, since COVID, is our work around mental health. We're going to really enhance and broaden our mental health services. We understand, that our focus is always on our individuals with Angelman syndrome, and that will continue to be very important to us. But we also know that if we aren't well as caregivers, as siblings, as whoever it may be, then it does affect that individual with Angelman syndrome. So we want to continue to be able to expand and grow our mental health services. A lot of what we'll do is, one thing we're going to be doing is integrating a lot of new conference offerings around the mental health services. So we are really excited about the conference coming up. I think we're past 600 registered, which is unbelievable. So if you haven't thought about the conference, I'll talk a little bit more about it later, but we're going to really focus on that at the conference. We're also going to leverage ASF platforms to increase mental health content. And so we'll continue doing our mental health and our counseling sessions for free for families. We will also continue to do, programming around support groups. And I will continue to work hard on understanding what are those barriers around mental health and how we can meet those needs. And so I'm really, really excited about that, to continue to support that. As I know, as a caregiver myself, mental health has been a struggle for sure, and it daily can sometimes still be a struggle that you have to really work at maintaining, and we want to make sure that we're able to support through that. And then once again, continue to provide free counseling services and support. Our next area that we're going to focus on is really creating connections for emotional and physical well-being. So the one thing we want to do is really be able to elevate the support experience for families, and that our families will express that they definitely genuinely feel supported by the ASF. So the one thing we want to do first is just understand the satisfaction and understand the programs that we do have and how they meet that need. What are the areas of opportunity for us to expand in those areas? How can we do better? And how can families that come to the ASF genuinely feel supported, no matter how they touch us, whether it's through the website, whether it's through a phone call, whatever it may be, that we can understand that our programs are working to meet that need. And if they're not, what we need to do to fix that. And so we will continue to grow and expand our ASF Family Fund. That is something we're incredibly proud of. It's something that is newer to the organization, only within the last 4 years. And what we've been able to do with your support, your fundraising, your donations through the Family Fund has been quite remarkable. And so we will continue to do that, and we'll continue to try to provide as much support as we can in that area. The other thing we're going to do is continue to grow our care committee. For those of you that don't know what the care committee is, the care committee was created close to 4 years ago as well, knowing that, every single day there's someone in our community that just needs a little sunshine and a little care. Whether it's their child is in the hospital, whether it is they're struggling with stuff at, IEP stuff at school, whether they're struggling with a relationship, whatever it may be, we want to be able to support and provide sunshine and care where we can. And so we will continue to grow that program and work on ways that we can also include more so our individuals with Angelman syndrome, our siblings, as we move forward. But our goal is, once again, how we can create and expand to help our families, no matter what, through their emotional and physical well-being in this journey. This is a big one for us, so I want to spend a couple minutes on this. The one thing that I've heard the most in my time here, my 4 years, 4.5 years in this organization, is how much our caregivers who are caring for individuals with Angelman syndrome who are adults, how much they're struggling, how much they feel they're in some ways being left behind, how much they feel that they're having to create create resources, systems, whatever it may be, for all of us who are coming up as young parents as well. And that really lays heavy on our hearts here at the ASF, especially knowing that I don't have the lens of a parent to an adult, my child being 8. I want everyone to hear that this is something that's really important to our organization, and we've been working really hard the last 4 or 5 years to see how we can change that. And a large part of our strategic plan will be to continue that. How can we amplify the level of support for our caregivers of adults with Angelman, and leading to an enhanced, satisfaction of assistance? How can we help those living with Angelman syndrome that are adults? So the first thing we're going to do is, we've listened, but we need to listen more. We need to understand more what those issues are and how to support them, how to attack them, how we can work through those things. The hard thing is that a lot of you who have older individuals with Angelman syndrome are living through circumstances that we didn't even know would exist, because it's so new to the community. So we're learning from you and having to create resources in that way. But we really want to make sure people feel supported. And so we're really going to have some conversations, and we've already had them. We're going to continue to have them, and we're going to continue to listen. Don't stop sending us messages about how we can be better. Send those to us and let us know so we can do something about that. We're also going to create a clinical provider referral program. The one thing that we know about our clinics is that a lot of our clinics were created in children's hospitals. Right now, I think it's 13 of our clinics will see adults with individuals with Angelman syndrome. The others, they're just not allowed to because of their medical system. We are now requiring any clinic that comes on that they will, to be a center of excellence, that they will have a very strong adult transition program. But outside of that, what we really want to do is also hone in on those neurologists, those dentists, or those that are providing dental services, GI, whatever behavior, whatever it may be. If there are clinicians out there that are providing excellent care for our individuals with Angelman syndrome, we want to make sure that we identify them, we put that information out there for families to have, and that we lift them up as an Angelman Syndrome Foundation certified clinician of some sort. So we've already started having a lot of conversations with a lot of these individuals who want to be a part of this referral program. But our hope is that as we continue to grow our clinical care, that we can make sure that our adults living with Angelman syndrome and their families continue to get the care that they need. We know that this is actually a problem that doesn't just exist with Angelman syndrome. It exists with all the 7,000 rare diseases out there. That clinical care for adults is a challenge. And we would love to be on the forefront of figuring out how we can help with that. So that's going to be something we're very committed to. And I'll talk in a minute, but we're going to work really, really hard to enhance our advocacy and our national partnership work around specific advocacy efforts, which we'll talk about here in a minute. So the one other thing that we're excited about is that we have within our clinic network, we have a group of amazing clinicians who have been in the space for a very long time, who have seen many adults living with Angelman syndrome, that are working on creating standards of care or a consensus paper around adults living with AS. Because we know that adults living with AS are dealing with medical challenges that us with younger kids aren't dealing with. Non-epileptic myoclonus is a great example. We've invested a lot of dollars into non-epileptic to understanding non-epileptic myoclonus and tremors and shakes, and we're excited that that publication is going to be coming out soon. But we know that there's a lot of things that you all are dealing with that we need to have really effective standards of care around. So that is something that we are working towards moving forward. Okay, so let's talk a little bit about research. So moving forward, our goal is to provide fuel for innovation and research. We want to grow our research dollars and for several reasons. One, we want to, as an organization, we want to improve our communication around what research we are funding and its relevance and impact to the community. We have, been an organization that has funded research for the last 30 years, but the area of opportunity that we have is helping families understand the research that we are funding and why it's important to the community and to the overall research landscape. So we're going to really work on how we can communicate more and help people understand when it comes to the research we are funding. We also just want to understand and address any sort of gaps in research and knowledge. The ASF has always been an organization that has, had this strategy of pilot funding, is what we call it. So a researcher comes to us and says, we have an idea, or we think something within the UBE3A region or whatever it may be effective, and it's an idea that we just need a little money for to see if it will go any further. A great example is we did the pilot funding for the ASO, for the CRISPR. They had ideas. We provided the funding, and then once they were able to take those ideas and grow from them, and they can go to other organizations like NIH or foundations or like FAST to be able to then get more funding to take it and try to get it into the clinic. So we're going to continue that strategy. The one thing we're going to really focus on, though, as well, is some of the clinical gaps that we have. Is once again, just a great example is the non-epileptic myoclonus. Understanding some of these symptoms and understanding what this looks like, and the idea around how are there other drugs out there that we can repurpose. Like I said, non-epileptic myoclonus is a great example. There are several drugs that Dr. Carson's looking at that's already out there and accessible that could maybe help with these tremors and these shakes, which I have not experienced those for Jackson, but I have seen hundreds of videos, and to watch one of our loved ones with Angelman syndrome experience something like that is quite traumatic, and I cannot imagine being a parent and seeing that. So that is something that we want to really look at and see, some of these symptomatic treatments, how we can really focus on those moving forward. We'll continue to partner with FAST to make sure that we are not duplicating efforts when it comes to our research funding, and that we are complementing each other when it comes to what we're doing with research. But research has been something that has been a cornerstone within our organization, since day one, 30 years ago, when the founding families somehow found $10,000 to create the first mouse model. So we will continue that commitment to pilot funding strategy as we move forward. So the next category that we're really looking at moving towards, and it's kind of new for our organization, is around being advocates for all. We want to mobilize and empower the community to actively participate and influence advocacy endeavors. We're going to look at how we can support our families, both local, to advocate both on a local and a federal level, and what is important to you as a caregiver, but is also what is important to the community, how we can provide you those tools to be able to really advocate in that way. One of the focuses that I think the ASF will particularly focus on, which is supportive FAST as well, is more so on around advocacy on you know, some of those day-to-day things that we challenge with. How can we advocate on the state level for long-term care options? How can we advocate on a state level, in a federal level, on respite care, or, you know, paid caregiver time, or whatever it may be, is looking at some of those things that we know our families are dealing with and will deal with, and how we can really fight with that. And that kind of moves into the Unite with AS organizations. It has been an honor and a privilege within the last few months to work with Ryan Fisher from FAST around advocacy issues. We're very lucky as a community to have someone like him who has been in the rare disease space for 20+ years, especially around advocacy on how we can really make change within the federal and local level. So you probably have already seen a lot of this work already happening together as a group on how we are really tackling advocacy and why it will be important, not only for the day-to-day living in our journey, but also how it will be important for, you know, once we get a treatment approved, how we can make sure that we're getting access for all to that treatment as we move forward. So some of you know, next week we'll have about 65 advocates here for the first ever Angelman Advocacy Day on the Hill. And so that day will be all day on the 7th. We'll have advocates from 25 different states that will be going in and talking to change makers on the Hill about the importance of access for Angelman. And so we're really excited about that. That will be something we will do every year, and we would love to have you participate. And then we will continue to work really hard on training and mobilizing community and advocacy strategies. So if there are things that you're really wanting to advocate for within a state level, we will do everything we can, both FAST and ASF, to support those efforts and to train and to do what we can as we move forward. And we're also, sorry, I'm not really good with these PowerPoints, apparently. As most of you know, we've had an advocacy committee here at the organization for 3 or 4 years. We're going to be reinvigorating that to concentrate more on local advocacy efforts around issues like long-term care, telehealth, those type of issues. And we will partner with FAST to make sure that we're all having the same message, because when it comes to advocacy, it's very, very important that all organizations that are involved with Angelman have the same voice as we move forward. It's very, very powerful and very strong. So if you're interested in the advocacy committee, make sure you reach out. We'll talk more about that when we get to that, how you can get engaged and get involved. Chloe, Catherine, am I doing okay? Okay, perfect. I know it's a lot of information to take in. And so when we talk about operations, the operations of the organization, we want to make sure that we're establishing a very robust and resilient infrastructure for the Ladder Learning Network. For those of you that don't know what the Ladder Learning Network is, that's basically our clinical network. And it functions in 3 different areas. One is the clinical care. We're setting up clinics across the world, and we're trying to do our best to ensure that our families have access to those clinics, whether it's in their state or not. You can apply for family fund dollars to get to a clinic, but that's part of the infrastructure of Ladder. The second part is we actually have a learning network where we have 80 to 90 clinicians every single month. They had a meeting today that come together and talk about the clinical care and clinical symptoms of Angelman syndrome. Today was all about the genetics of Angelman syndrome. And so these clinicians are coming together and learning from each other so they can become experts themselves with Angelman syndrome as well. Sometimes they'll talk about challenging cases. I have a really hard seizure. I've tried every drug medication. What can I do? And they're talking to each other, which is really, really important. And the third part is the ladder database. For those of you that don't know what the ladder database is, I like to call it kind of like the brain of data for the Angelman community. We learned early on when I came on that there was definitely data that was siloed all over the place, right? And we also were sitting on this gold mine of data in the clinics. So we created Ladder that it can collect clinical data at the clinics that we fund through the network, but it also holds the natural history study data, and it also has the capability and is holding other data that kind of was being maybe siloed out at a research academic institution and there was nothing we can do with it, or Ovid's program didn't make it to the finish line. And so they gave us all their data, which is really, really important. So the Ladder database kind of brings all that data together in partnership and support with the global Angelman registry. So it's not a parent registry, it's a database that holds data. That's really, really important for us to understand kind of the clinical aspects of Angelman, but also it's been a really great tool for our industry partners as they are, creating clinical trials, as they're working through creating endpoints and biomarkers. So those are the kind of 3 areas that the Ladder Learning Network is under. So our goal in the next 3 years is how do we make sure that the infrastructure is strong and that it's unyielding and that the impact can continue long for as many years as we need. We know that a lot of these clinics are currently doing clinical trials and will in the future do clinical trials and phase 3 trials. So we want to make sure that these clinics are strong and ready to go. So we are going to look at, obviously we're going to be enhancing our new clinics and existing clinics, and we're going to be looking at future ASF clinics. A lot of people ask me how clinics are established. And really what we've done is we have a beautiful heat map. We have, close to 5,000 individuals in our registry here at the ASF, and we're able to heat map them to see within the US where they're all located. And what we have tried to do is create clinics that are in those areas. Now, we don't just create a clinic with someone who doesn't know Angelman. So I know a lot of you have been desperate for a clinic, and the reason why there might not be a clinic there is because there is not specifically an expert that is there in order to be able to serve the community. We put our doctors, our clinicians, through a very solid vetting program in order to best serve you. So we will continue to bring on clinics. You'll probably see a little bit of a slowdown this year and next year as we're trying to, 1, build up the clinics we have, 2, create opportunities for our adults living with Angelman syndrome to ensure that they're getting clinical care and that there's a transition program set up. And then we're also going to be working really hard on updating consensus papers around the symptoms of Angelman syndrome. So we know that there's a lot of amazing publications out there on how to treat seizures, how to treat GIs. We have an amazing standard of care that was led by Dr. Jessica Dewis to put those together. But we also know now that we have all this data within Ladder, this clinical care, we're learning more and new medicines are coming on to the pipeline. So we need to update some of those standards of care. So we're going to be working really, really hard on that. Our first one will be a seizure paper. We had, I think, close to 160 people who did the seizure survey. So we're working on what that paper looks like now and hopefully getting that out to you soon. But those are one of those things that we're really going to be looking at as we move forward. We also want to really expand the data collection and impact from the Ladder database. We have a lot, I think we have over 500 families who have consented to share their data if they've been to a clinic or whatever it may be. And so if you have been to a clinic and that you would consent to share that data, please make sure you do that. I will ask Catherine and Chloe to put the Ladder website in the chat if you don't mind, especially if you've been to a clinic, because if you give us permission, then we can get your data connected, and that would be really huge for us as we're doing these consensus papers moving forward. And then, like I said, the non-epileptic myoclonus paper will be coming out soon, and I think that's going to be huge for the community, which I'm really excited about. Another thing with operations is we really want to work hard to increase our volunteer engagement to really bolster our mission. We're incredibly blessed with the volunteers in the community that we have. They're amazing, whether they're walk coordinators, whether they're on one of our committees, whatever it may be, we could not survive, function, thrive without you. And so we're going to look at how we more so streamline that program, the volunteer program, how we can engage people, find that sweet spot for them that they're passionate about and connect them in that way, knowing that you all have very small amount of time to give, but making sure that if you want to volunteer, that we really have those options and that's set up for you well. We're also going to continue to really work hard with fundraising to grow our revenue. You know, as much as you guys are unbelievable in what you do for us to bring in dollars to support us so we can do our mission is unbelievable, but we want to do so much more for you. So we're going to really work hard on looking at new avenues of revenue to where we don't have to work or count so hard on our families. Because we know that's exhausting, it's really tiring in order for us to really continue that support. We're also going to look at ways that we can create an endowment to make sure that some of our programming that's incredibly important to our families, we can make sure that there's a lasting impact. A great example is the Pritzker family that gave us a beautiful gift to be able to really to endow a fellowship to ensure that we can continue to have clinicians that want to come into the Angelman space to learn, to support, to grow, to treat, to do trials. That's a great example of what that looks like. So that is the overall layout of the strategic plan. Now, keep in mind the things that I shared with you are the things that we're really working on in the first year. I will be back this time next year to talk about what we're going to be doing in the following years, because our goal is to be incredibly transparent with you about what we're doing and how we want to know how we can be better and how we can support you. I want to also take this opportunity to encourage you all to get involved, and these are ways that you can get involved. With the committees, we have an advocacy committee, we have a parent advisory committee, which we'll be accepting new applications for soon. We have a siblings committee, we have a care committee, Friends with Wings, adult task force, access task force, so many ways that you can get engaged and involved, and you can find all that information on our website. But if you're interested, you can always throw it in the chat or the Q&A to ask for more information, and we'll make sure to reach out to you. Some other ways is if you're interested in being in the board, it's a nomination process, but I'm always willing to have conversations with anyone who would be interested in doing that. We always need walk coordinators. We have amazing walk sites, but we have a lot of states that don't have any walk sites. And the walk is one of our biggest fundraisers, but it's one of our biggest community engagement activities as well. So we could always use those. Family Champions, the conference, like I said, the conference is coming up. If you want to get engaged and volunteer in any way, we'll take it. And we're going to create an internship program, and we're looking for people to support with development. There's always ways to volunteer at the ASF. We'd love to have you. And then just a reminder, the ASF walk's coming up May 18th, family conference July 23rd through 26th, and then we have our Chicago Marathon. So there's plenty of ways for you to get engaged and get involved. The last thing I wanted to share with you before I answer questions is I want to make sure you guys know who our team is. I want to make sure you know that if you have questions or if you need anything, or even how your dollars are spent, I want you to understand what that is. Obviously, you guys know me. Eileen Braun, who was the executive director for many years before me, she handles all of our finances, contracts, and administration. Katie is our ladder director. So if any questions about the clinics, about ladder, or about anything, you can ask her. She's also a genetic counselor. So if you have questions about your genetic reports, she loves talking to families about that. Catherine, who is on the call tonight answering, is our family support person. So anything around committees, family fund, questions about the counseling program, anything around family support, her or her beautiful child, Stefan, as you can see in this picture, would be more than happy to help. Julie is one of our admin assistants that keeps us on, keeps you, when you get letters that someone has donated or thank you letter, tax documents, she is the one who's keeping up with all of that. And then Liz Thompson, who is our development director, who's working really hard on increasing our streamlining of funds in different ways. And she is doing grant proposals, foundation requests, corporate sponsorships. She's amazing. Karen is keeping all of us who are out there raising money in control and not in trouble. She helps with all of our end of the year appeals and our communications. She's fantastic. Alyssa is our special events director who oversees our walk and all of our what we call them grassroots fundraisers, but a grassroots fundraiser basically is if you're doing a golf outing, chili, cook-off, whatever it may be, she's here to support you. And I want to make sure you guys know we do have a new function on our website. If you are doing a fundraiser, you can go on to fundraisers and fill out a quick form to let us know you're doing it and what information or supplies you need for it. If you need brochures, stickers, pens, whatever, you can do that. She's the one who'll work with you. And then Chloe, who is on tonight as well, is our community engagement director. She is everything conference, marathon, International ID Day, and just general support. And then Amy Friel, who does all of our website, our social media, the newsletters you get, everything. She's the one that does that. So I'm gonna stop the share, and I'd love to answer any questions that may have not been answered. Okay. So I'm just gonna go through here. Chloe and Catherine, what's the best way? It looks like everything kind of happened in chat. So let me see if I can go to the beginning and let me see what I can answer here. Okay. Yes. There's a mention about adult gaps for those approaching adulthood, and I agree with that as well. So our adult service task force, along with our organization, is working on how we can prepare families even before the transition period. We do have an amazing transition checklist. I think, Robin, I don't know if you're on, but Catherine, you can answer this as well. I think it starts with things that you want to think about even when your child is 13 to 16, I think, when it comes to the transition. That's on our website, but we will continue, and thank you for bringing that up. That's completely a true statement. Let's see. You never interrupting me. If you have questions, please feel free to put them on here. Oh, great. Is there a directory of AS clinics by state? I live in New Jersey, need a close clinic. I think someone posted the link, but yeah, all of our clinics are on our website under the clinics. You can just kind of look, click. And if you click, I think the one thing that maybe our families don't know is that if you click onto a clinic, you'll see some stickers at the top or some like badges. One is a center of excellence. To be a center of excellence, you have to meet certain criteria. And so it's, having all the services from genetics, neurologists, all the way down to SLP, serving adults. To be a center of excellence, you have to meet certain criteria from the foundation. You'll also see a badge of their clinical trial site. A lot of you have asked about clinical trials. You can look on our website at the clinic, and if it has a clinical trial badge, then you can also look in that page, and it'll say which clinical trials they're doing and who to contact. So if you're interested in doing a clinical trial, you can always reach out to those research coordinators and let them know, and they can help you along that process as well. And then the other badge is whether or not that they are participating in the ladder database. So that means that they're entering data into the ladder database. So all that information is on there. I also believe on our website now too, we have whether or not they serve adults or what ages they serve. And so we're working on updating that as well. Yeah, I hear you. Clinical care is really hard to access as an adult. Yeah, okay. So one of the questions is that they feel like the demographic, the West Coast there's not much happening compared to the East. Great, great feedback. Several reasons for that. I think you're speaking mostly on clinics. I think that's what you saw. One, demographically, we have a lot of individuals with Angelman syndrome living on the East Coast. Also, we have a lot of experts that are Angelman syndrome specific on the East Coast. We are working very, very, very hard to find clinicians and experts in the Utah, Seattle area. We've had no luck. So if anybody's on tonight and knows someone that has seen a few individuals with Angelman syndrome and you like them, it's a good start for us. We can definitely reach out to them and have conversations with them. But it's not that we haven't been looking up there. Like I said, we don't just choose any clinic to be a clinic. There has to be, they're vetted in some ways. So we're not trying to leave out the West Coast. We're definitely looking in that area, but thank you for bringing that up for sure. Okay, let's see. Okay, I see that. Catherine, I see that you answered that. So I'm just gonna skip that. Okay, good question. If you have a child, and this might be it, but this might be a good question to share with anyone. If you have a child with no seizures and is pretty healthy wise, does that really help to note when you do surveys, or is that info the research or whatnot? Any data or any information you can give us on your child with Angelman syndrome is important, because what we've learned about Angelman syndrome is it's a spectrum, right? I mean, all of our kids kind of hit different milestones, have really aggressive seizures, don't have aggressive seizures. It could be different based on the genotype. So really any data that you can give us or that you can talk about when it comes to your child is going to be important. So please don't ever feel like, that your information or your data is not important. Any data is important for our community. So thank you so much for asking that question. Yeah, thank you for answering. The best way to set it for committees. You can look on how to make an impact. Also, feel free to reach out and email. Chloe and Catherine are great people to reach out to. They can get you connected and engaged and involved, and we would love to have you. Okay. Someone made a comment about how conference costs to travel easily can come to close to $3,000. We work really, really, really hard at the foundation to make sure that those costs are as small as possible. I think we gave out close to 100 to 200 sponsorships this year. We're working really hard to meet the needs of everyone. The conference is free. We're providing meals at the conference this time. So we're doing everything we can to make that cost is as cost effective as possible. The other thing we do with our conference, if you haven't noticed, is we also move it around the US. We try to have it in different areas so that the travel isn't as hard, and it can, other different regions can participate, right? So we will continue to look at this and continue to do everything we can to make that cost as cheap as possible. So one of the questions was, does the ASF still have state-specific representatives for questions and programs and services in state? Yes, so that's our Family Champion program, which we're going to be launching kind of an update to that. But also, if you look on our website, there is a state-by-state resource guide. So you can go to that and you can look at your state and see the resources. But the other thing we're going to be doing is an interactive resource library with our new website. So this will be a really fantastic tool for you to be able to go through and use, and it will be a lot more user-friendly to find the resources at your site. Okay. Yes. I see someone with an iPhone that says, I'm getting knows I'd love to get more involved. I will make, whoever that is, we will get you more involved. Okay, let's see. Is that it? Oh, someone asked, is there a feeding specialist? A lot of our clinics have a feeding specialist. If you want to send your information to either Chloe or Catherine through this chat, we can make sure to see how we can connect you in that way to get that information for you. That is also going to be one of our areas of our consensus paper that we're looking at, that we are going to fund with a lot of data that we've come up with recently to be able to help with that. So stay tuned for that as well. Someone asked about the timeline for the new website. We have an aggressive timeline. We're hoping that best case scenario, 6 to 12 weeks. Worst case scenario, depending on what may be happening, a few months. But website renewals it takes a lot, and we have 30 years of information on our website. So we want to make sure that we go through it and make sure all of it, what's still relevant, what's not, what needs to be updated. We're going to be working really, really hard on all that. So we will keep everyone up to date as we go through that. Great question. Okay. So we have a few more minutes left. I would love to hear for the people that are still on, like a thumbs up that we're in the right direction, that we're meeting the needs. Is there something we left out? If there is, make a comment. I just want to make sure, once again, that we're always, I love all those thumbs up, that we're always, meeting the needs of our community. We will continue to work incredibly hard on collaborating and working with all Angelman organizations as much as possible. Collaboration is really, really important, and we will continue to do that. We're really excited about the landscape for Angelman, for our, the hope and the future that's out there for us. But we also know that we still have a lot of work to do. And so we will continue to work on that. A question just came through about what's the best way to handle state advocacy for guardian parents to be paid caregivers. I don't know who did that message. We will, if you can send me a private message, a couple things with that. One, we're actually dealing with that here in Indiana. I've been on the Hill several times within the last couple of months to really fight this as being a paid caregiver. Not all states have this, but I will say, if you think you don't have it, do some digging. I think for a long time, Indiana, people thought Indiana didn't have it, but it just was hiding under a different waiver. And so we can help you with that as well. But if you need specific language, and that's one of the things we're going to be working on, hopefully in partnership with other advocacy groups that are dealing with this, but also with FAST on how we can create language for you to really advocate within your state level. But if it's an urgency issue that's happening soon and you need some guidance, feel free to reach out to me. It's something that we're dealing with here in Indiana and fighting very hard for ourselves. So, and thank you so much. Yeah, we are very excited to work more with adult transition. We like I said, we've heard that loud and clear. Well, I see a lot of thumbs up, so I'm hoping that we have met the mark in some ways for you. Just to close out, I just want to sorry. One more question. Can ASF supply us with a list of AS in our state? Would that be helpful for networking? That's a great question. So a question came through is, can we provide the names of people that are living in your state? So when people sign up for the contact registry, we ensure them that their information will be shared. So technically, we cannot just give out people's information that live in their state. However, we are talking about how we can create some sort of interactive function on the website to where you can scroll around a map and find the people and the contact information in their state. This is also a function of the family champion moving forward as well. We would love to be able to give out that information, but we also want to just be very respectful for the people who do give it. I love the idea, and I'm so thankful that families want to connect in that way. So we're working through that. Great suggestion and great idea for sure. Okay. So we're at 9 o'clock. I promised you I would only keep you at an hour. I want to thank everyone who attended tonight. I'm so thankful for each one of you and for allowing myself and our staff to serve you in this way. We take it as an incredible honor, and I want to continue to encourage you all to reach out. And please let me know, let Chloe, Catherine, anyone on our team know how we can be better, how we can do better, and how we can serve you. We try to do as much as we possibly can, but we also know that sometimes we just can't do it all. But we always are up to having that conversation. So please don't hesitate to reach out. I love you all very, very much. And you know, I'm in this with you, with my sweet boy. I was trying to find my button I used at the White House today of a picture of, I tried to get a bunch of Angelman kids in a picture, and I don't know where it's at, but I take you with me all the time. And so thank you guys for allowing us to serve you. And if you need anything, please don't reach out. The strategic plan will be on our website, so feel free to grab it, use it, ask questions, whatever you need. But have a beautiful evening, and I hope to see you all at the walk, at the conference, or sometime soon. Good night, everyone.